A new mother felt something was wrong when she started experiencing chest pains at the end of her pregnancy, and they continued even after giving birth.
Yeah, that's right. Her symptoms were dismissed for months until she was eventually diagnosed with heart failure. This next story is exactly why Northwell created the Katz Institute for Women's Health. It's a G thing.
G Thing, brought to you by Northwell, who believes when we raise health, we raise everyone. Northwell, raise health.
Cassidy Hayes is the proud mother of two young boys, Walker and Pierce. Near the end of her first pregnancy, Cassidy started having symptoms that worried her.
Every time I would get up in the middle of the night, I could barely walk. I felt like I was drowning. I could not lay flat. I couldn't catch my breath. I went to my doctor several times where he told me, "Welcome to pregnancy," and dismissed my symptoms.
Cassidy gave birth to a healthy baby boy, but her health just got worse. Cassidy says for 4 months, her doctors kept telling her she was just suffering from anxiety. But it turns out Cassidy had postpartum cardiomyopathy, a rare form of heart failure that can happen at the end of pregnancy or a few months after giving birth.
What was that feeling for you of being dismissed as an anxious woman in pregnancy? What was that feeling like?
It was terrifying.
Cassidy found her way to the Katz Institute for Women's Health, and Dr. Evelina Graver, a cardiologist and the director of Women's Heart Health program at Northwell.
So when I met Cassidy, she was already having symptoms of what's called decompensated heart failure in the setting of her peripartum cardiomyopathy, which is weakening of the heart muscle in the setting of her pregnancy.
Why was this missed by other doctors that Cassidy was going to and dismissed, if you will, as anxiety? Why was it missed?
People don't think of young women who just delivered a baby should have heart disease. So unfortunately, the bias is just not within the lay public, the bias is within the medical staff as well.
So at the Katz Institute for Women, right?
Yes.
You're trying to change the way women are treated, right? And how are you doing that so that women do not walk into an office treated by a male doctor and feel that they're disadvantaged? How are you trying to work that through?
Education and awareness. And I'm not talking about just education and awareness within the lay public, but education and awareness within my own medical staff.
Dr. Graver educates the Katz Institute for Women's Health medical staff about a phenomenon called adverse pregnancy outcomes, which can affect a woman's heart health during and after a pregnancy.
What are women who are watching this today, what is the one message that you want to have given to these women that should stick?
Number one, cardiac disease kills more women than all cancers combined.
How is Cassidy doing now?
Phenomenal.
I could not be more grateful to Dr. Graver and all of the physicians at Katz. I feel like they really do take the time to look at women's health as a whole and treat the entire person, both mentally and physically. I would like to take the time and say thank you as well. I feel like this is a topic that sometimes is really missed. And I'm so grateful to people like you who are taking the time to really get this to the forefront. Even if it just helps resonate with one woman, I feel like we really will have had a successful mission. So thank you.
What a story.
You know, I was really caught. I saw both of you react when she said that cardiac diseases cause more difficulties for women than cancer.
Right. We normally associate it a lot with men.
Right. And so I guess, you know, the presentation right now is better because the education for doctors is better for this cardiac problem pre-pregnancy, during pregnancy, and after pregnancy.
But awareness and hearing stories like that makes you certainly pay more attention.
Yep. All right. So
Thanks,